Hey, welcome back, everybody. This is part 2 of a video that you saw a while ago. We'll put that right below this that you can go back and watch that Quint did with Pete Alberti from Kentucky Health Solutions. But today I'm joined by Justin Aulds, also from Kentucky Health Solutions, to come down and talk more about Medicare, about the changes that are going on, about all the things that are going on in that world as we enter open enrollment season, and it's going to be a hot topic coming into the close of the year. So, Justin, thank you so much for coming on and for joining us today. Great.
Happy to.
Tell me a little bit about yourself. How long have you been with Pete, and tell me about your life.
Yeah, so I was born and raised around here, went to UK.
All right.
That.
We love UK grads, yeah.
Exactly. So always kind of been here in town and in the area. As I was graduating college, didn't really know what I wanted to do, and found the opportunity with Pete.
Nice.
Back in 2018.
So what'd you graduate? What'd you graduate with?
I did agriculture, economics, and business management.
Okay, wow. So a little bit across the map.
Yeah, a little bit off, but I wasn't quite sure what I wanted to do because I never really had an inkling. But I do enjoy helping people figure complicated things out. Yeah. And that's where Medicare comes in.
Sure,
this is one of the more complicated things to deal with. So I'm going into my 7th year.
Fantastic.
Into this, and got some more changes ahead of us, kind of like last year, but we'll just roll with it.
And we were just talking, you're married and you have a little one at home?
Yes, yeah. I've got a daughter, 2 pups, and so, yeah, she's 7 months old. We were just talking just now getting through the night. So
oh, my goodness.
We're hoping we keep that, especially through this busy season.
Yeah, I bet. So this is truly the busy season for you guys as open enrollment is opening up and all these things are happening. So before we get into the weeds and some of the changes that are happening this year, I want to help our listeners understand the basics, because we can use the jargon a lot and say Medicare Advantage, Medigap, all these different things. Can you break down the difference between Medicare Advantage, regular Medicare, and when people use that Medigap verbiage?
So the reason we look at secondary coverage, the Medicare Advantage, Medigap, Standalone Part D drug plans, is because original Medicare A and B doesn't cover everything.
So that is the original. A and B is the original.
So A and B, that's your red, white, and blue card. That's your original Medicare. So that's what's going to, it covers hospital, skilled nursing, has some high costs for that. Part B services, that's the one you hear with a deductible, 20% uncapped. So the big thing is original Medicare doesn't have a cap.
Okay.
That's why we want secondary coverage.
Got it.
Because we don't want people using all their money on their health care as they get older.
Right.
So the way I kind of break it down as simple as possible, Medicare Advantage is a kind of pay-as-you-use-it plan. It's very similar to like employer coverage. You'll have co-pays. You'll have a max out-of-pocket, things like that. And the Medigap plans, those are more of a pay up front, and you don't have to worry about high costs on the back end.
So you're focused more on the premiums in that Medigap plan.
Exactly.
And now the Medigap is where you have all the different letters, right? There's a bunch of different ones.
There's quite a few different letters. We really kind of focus down on 2 now. So for a while, Plan F was really big, but starting January 1st of 2020, nobody can get a Plan F anymore unless you already had Medicare prior to then. So you can still get it. It's just really expensive, so it doesn't really make sense anyway, even if you are eligible for it. But Plan G and Plan N are the 2 that we primarily will look at now, just because N does offer a little bit of extra savings. There are some more costs associated with it. But that Plan G is usually what we start with. It's kind of your quote-unquote Cadillac plan now. Because it has the lowest out-of-pocket cost after that monthly premium.
Fantastic. So talk to me a little bit about, I know there's some changes going on. It seems like particularly maybe with Part D. So you had your A, B, you have your D, which is your drug plan. There's some changes going on with Part D. There's also some changes that happen every time around this time of year. So talk to me a little bit about that.
Yeah, so the biggest change going into this next year, again, is with that Part D, and it's that they're putting a $2,000 cap on medication. So previously there was 4 stages to a drug plan. Excuse me. You had your deductible stage, your initial coverage stage, the coverage gap, or what some people call the donut hole. And then you'd have the catastrophic stage where everything would be 0 if you met that cap. So most people on average were spending about $3,400 out of their own pocket to hit that cap. And so what they're doing now is, because so many people were paying so much money for these medications, they're putting a $2,000 cap to try to reduce the burden. Now, that doesn't always mean you're going to pay the full $2,000 though. Because some plans are designed to where it's kind of a greater of system. So basically, if your plan has a copay for higher tier medications, for instance, or more expensive medications, that copay, you still get credit for 25% of the cost of that medication.
Okay.
Even if the
copay is lower.
Exactly.
Okay.
So you may see some people, especially with certain plans, that are paying less than the full $2,000 to meet it, because it's that greater of system.
Okay.
So
understood.
it's a little confusing on the math, but when we help clients with doing the review, we kind of break that down for them.
Yeah.
The other piece with that is Medicare has introduced a payment program.
Okay.
So for those people that have a lot of expensive medications, you're going to hit that $2,000 cap probably in the first couple months. And that's just not feasible for a lot of people, because, that blows up your budget, because it's a couple grand right away.
Right.
So what they've done is you're able to contact the insurance company that your Part D is with, whether it's Advantage or Standalone, and sign up for the payment program, and it'll actually spread that out over 12 months. So your prescriptions are zero at the pharmacy, but then you pay a payment to the company
to basically hit that $2,000 out-of-pocket maximum.
Exactly.
So that changes significantly.
Oh,
I mean,
yeah.
that's a big shift that they've had over the years. Does that $2,000, does that cover all medication, or is there certain ones that it only covers, or it covers pretty much anything?
So any Medicare-covered medications.
Okay,
so anything that's
Medicare-covered.
in the formulary of your plan.
Okay.
So that's why it's really important, especially this year, to take a look at those drug plans, because they did a lot of tier changes. So medications moving up and down. You also had plans premiums go up like crazy in some instances.
Okay.
Some stayed stable, so it just varies. But it's really important this year, especially if you have a standalone Part D.
So what should people do in order to find that information?
Yeah, so the annual notice of change document is something that everybody gets. You should probably have received it before October 15th for sure.
Okay.
And basically that'll give you an idea of what those medication tier pricing is going to look like. So some plans went from a copay on tier 3 brand names to a percentage in cost.
Okay.
And so it's important to take a look at, did your plan do that? And if so, how are your medications affected?
Okay.
So the easiest way, of course, we as agents can help with this search and look. We also, on our website, in our resources page, there's a YouTube section where we actually have a tutorial on how to run your medications on Medicare.gov.
Okay.
So you can actually go ahead and take a look and get ahead of it if you want to.
So you can basically look at a list and say, okay, well, this is about what I'm going to have to pay in this year.
Exactly. So you plug your medications into the system, you plug in your preferred pharmacies, and it'll spit out, hey, this is the lowest cost plan based on premium, deductible, and any copays you have to pay.
Okay,
And
good.
it calculates that $2,000 for you.
Fantastic. Well, we'll definitely make sure we put the link to their website below so that you guys can go on there and check that out as well. What about just your standard Medicare? Is there any increase to premiums? What's going to happen there?
We do expect there to be an increase in the Part B premium and the Part
Which
B
is normally
deductible.
people are paying about $170
Yeah,
now?
$174.70 is it for 2024, unless you have an IRMA adjustment. So if you're a higher income individual, they look at your taxes from 2 years ago,
Right.
and that's how they base that.
And we talk a lot about that in the previous video with Pete and Quint. Definitely check that out, because we talk all about the IRMA and how that's important, because we have to deal with that whenever we're talking about tax strategies with folks as well.
Yeah, especially as you're retiring, so you're
Right.
getting to those Medicare years. So the big thing with the Part D and looking at those changes, I forget where I was going with that.
Part B and the
Part B,
increase
sorry.
of premiums?
So the increase on the premium and the deductible will usually be done in November. So
Okay.
they try to wait till closer or after election time to do that.
Got it. Understood.
But those will be released then.
Okay, so then what are you expecting? You're expecting quite a bit of increase? Or?
The numbers that I've seen for people that have projected, we're not expecting anything crazy.
Okay.
I would expect a little bit of an increase. I don't want to throw a number out there and be
no
completely off
problem.
base.
But a small increase.
For like last year to this year, it went up like $10 to $13.
Okay.
Something. It wasn't crazy.
Okay.
So we expect it to probably fall in somewhere in that line.
Okay.
A lot of the time, though, unfortunately, for those that are on Social Security, your Social Security goes up about the same amount that the premium does.
Understood.
Because it's all based on the same percentages.
Gotcha. That makes sense. So whenever someone is looking at this, that we've talked mostly about the standard, kind of your A, B, your Part D, and then potentially getting one of those supplements through a Medigap.
Yeah.
When you have Medicare Advantage, they're sort of packaging it for you, right? What are the changes that you can see sometimes on a yearly basis in those Medicare Advantage plans?
Yeah, so with the Advantage plans, they're generally a little bit more stable.
Okay.
Just because there's so many more components to it. And they have more rules around how much they can change. to an extent. But what you'll see, especially with these drug plan changes, what we've kind of been told is that for the most part, the companies are taking on about 60% more cost when it comes to medication. So what are they going to do with that? They're going to pass some of that along. So that's on those Part D premiums. Right? On the Advantage plans, a lot of the key points about it is that they are low cost, at least up front.
Okay.
So what they've done instead is they've taken a look at some of those extra benefits. And so you may see reduced allowances on certain extra benefits. You could see copays go up in certain cases for like hospital or doctor's visits. Medication changes, because like I said, some of the plans may have changed from a copay on those higher tiers to go into a percentage.
Yeah.
So there's a few different things that they can play with. What we've seen so far doing our reviews, because we already have access to the information for next year. We just can't actually do applications yet until October 15th. All of that we've looked at, most people on Advantage plans are pretty good to stay where they're at.
Okay.
It may be good for select plans. There are some county exits this year, so certain counties plans will be pulling out of, or some plans are just terminating, so they just weren't profitable for companies.
Okay.
So they, again, would have notified you by now whether or not that was happening to you. They always send a letter, and we've reached out to our clients that are in those scenarios because they have to make a change.
Okay.
So that's some of the changes we saw, certain plans exiting, some coming in for new stuff, and then, again, some of those extra benefits is the big thing.
So what all can someone change in a given year?
Yeah.
And do you see that often? Like once people are into a Medicare plan, do they change their supplement often, or do they change their Advantage often?
Not too often.
Okay.
So it kind of depends. So obviously, like last year with Baptist Health having some issues with the contracts, we had to make some adjustments there. But generally, year to year, if it's pretty stable, most people stick with what they have because they're used to it, they like it, they trust the company because they've been there for a while. Most of the time, my recommendation on like supplements, unless you have a crazy premium increase, usually you leave that alone for probably 5 to 7 years.
Okay.
Just because that's the point where it's like maybe that cost is getting a little bit different. But keep in mind, you generally have to answer health questions outside of certain guaranteed issue periods. Outside of that, the Advantage plans, like I said, more stable, less changing there. It's probably more on the Standalone Part D. That's where we see the most movement.
Okay.
And so during this annual enrollment period, everybody can keep in mind, you can go to an Advantage plan if you have a supplement and a drug plan. You can go from Advantage back to a supplement and drug plan. You may still have to qualify through the health questions, but you are able to make changes to go either way.
Okay, got you. But that Standalone Part D, again, they go on the website. You have a link. You go onto the website. They put in their drugs. They can decide from that drug list what the best Part D is.
Exactly.
Is that right? Okay.
So usually Medicare.gov will default, once you've plugged everything into the system, lowest cost for retail. So you can put mail order in, but it'll usually sort by retail cost.
Okay.
And that's total cost. Monthly premium, deductible, co-pays, all of that.
Okay.
Rolled into one, it gives you that full cost.
Got it. So regardless of if they're going to make a change or not, that'd be helpful to figure out, hey, what are my costs going to look like for next year? So let's run all this math and look at it.
So you can at least project a little bit, and you should, for the most part, see a number $2,000 or less.
Fantastic.
If you see something way more than that, because I've had a few that I've run that it showed up that one of the plans was like $22,000. That usually means that the prescription's not covered by the plan.
Okay.
And so there are certain medications not yet covered by Medicare. So just keep that in mind, especially with newer medications or those really, really expensive brand names.
Okay.
So you want to plug all that in so you know whether or not your stuff is covered.
Okay.
Something expensive could have been pulled off a formulary, especially with these changes in the next year.
Fantastic. All right, now I'm just going to give you a scenario.
Okay.
When you have someone that comes in, let's say, I know a lot of our clients have used you guys as a great resource to help them through, figuring out what to do when they're navigating this space. So someone comes to you, they're turning age 65 in a few months, they're starting this initial process, not changing necessarily.
Yeah.
How do you kind of carry them through that process of figuring out what's best for them?
Yeah, so usually we kind of sit down and do a 101.
Okay.
So I like to approach this from an education standpoint. I don't look at this as necessarily a sales gig.
Right.
Because it is, but when we sit down with these people, they're making a big decision about their health care. So we want to make sure they're educated in what are the basics. So what is Part A and B? What does it cover? What does it cost?
Yep.
Then from there, we go into here are your secondary options. What sounds good to you? Do you like the kind of pay as you go with an Advantage with a lower monthly? Or do you want to pay a higher premium and have very little out-of-pocket cost and the freedom to go wherever accepts Medicare?
Gotcha.
So we kind of break that down and then once they decide on which option they want, we break it into the company. So since we're an independent agency, we work with multiple carriers, all the big carriers in our area, to get those specialized, like more specialized and individualized things, because Medicare is individualized. The same plan doesn't work for every person. We have couples that are on different plans because it's just a better situation for them.
Yeah, okay, makes total sense. Okay, so I know typically your business is working with Medicare folks.
Yep.
But you don't just work with Medicare folks. You work with people that are still working, that are still on healthcare plans. So what does that look like, and what does it look like during an open enrollment period that everybody's about to come up on?
Yeah, so we actually have 2 open enrollment periods that run at the same time. That's why this period of the year is so crazy for us usually, because October 15th through December 7th is Medicare. So that's where you can make your changes to that stuff. November 1st through January 15th is the individual under 65 open enrollment. So that's generally going to be through the Connect Marketplace.
Okay.
And so we help a lot of folks with that are in that area getting to Medicare. So I've got a few clients that I'm just planning to meet with because they need coverage from the beginning of the year until September of next year, because that's when they turn 65. So usually we'll just sit down with them, run through what options are available, because the individual market for Kentucky is not the best.
Okay.
So pretty much now with the new rules that went in place, so there's another new rule
of course,
with the individual.
Always a new rule.
So September 1st of this year, there were off-marketplace plans that had larger PPO networks, but they were considered what's called a short-term plan.
Okay.
So there was one in particular that we really loved, but because it covered very similar to a marketplace plan. It still had a couple caveats that made it a short-term plan. But basically, those plans can no longer last more than 4 months. So really the only option for full credible coverage we have anymore is the Connect Marketplace.
Got it.
And so it's just important for everybody to know you got to do some planning around that as well, especially when it comes to those that retire early, because they have the funds to do so, because they look at what your income is now usually. They're not looking in the past like Medicare does.
Okay.
So let's say we have somebody retiring at the end of the year or close to the end of the year. Sometimes it's cheaper for them if they worked most of the year where they have a higher income to go on their COBRA plan for a couple months. And then starting that next year, let's say 2025, their income's going to drop because they're no longer working. They're just living off their investments or retirement. And so they can potentially qualify for savings on that marketplace to help reduce the premiums and help protect their nest eggs. So that's what we try to do, is sit down and see, what's the best way we can look at this for you? Is COBRA more beneficial for you? Because another thing to keep in mind anytime you are making that transition from work, especially if it's pre-65, is you can have COBRA for 18 months. But if you retire partway through the year, usually when you sign up for your COBRA, your deductible and everything else will carry over. So if you've met your deductible previous in that year, then it may be good to stay with it.
That makes a lot of sense. Yeah. Okay. So. Anything else that our folks out there should know or be thinking about when we come into this time of year?
I mean, not really. I would just say try to get ahead of it. Get in early, just because it is a very busy time of year and there are quite a bit of changes this year. There has been plenty of people that have been able to just stick with where they're at. But usually what we recommend for our clients, reach out to us. We'll have a brief conversation about what you have, what it looks like, run a quick review, and if we need to make a change, let's meet, let's make the change. So I would just say get ahead of it, but those are the major changes that are coming out. So those are the things to look out for. It's kind of what we've already discussed, but just get ahead of it.
Okay, yeah, fantastic. and look out for those letters, right? The letters that's going to be coming out any day now. You should be getting
so
the information on what
you may already have gotten, or they have to be there by the 15th usually. So if you missed it, then there are resources online available. So if you have a certain plan, you can go to that carrier's website and they usually have access to that document online. We also have access to some of those documents. So if they're a client of ours, we can go ahead and share some of that information.
Awesome. Thank you so much, Justin. Thank you for joining us today. You've been super helpful. Reach out to them. We'll put all of their information down below here. Kentucky Health Solutions. They've been such an awesome resource for our clients out there to be able to decide what is that best healthcare plan for you and see if there's any changes you need to make through the end of this year. Again, all of their information is going to be below, so feel free to check that out. Click the links and then go from there. Thank you again, Justin.
Of course.
You have a good one. Thanks.